here with Saverio Rinaldi, who is the CEO of Clarity Healthcare Solutions from Ontario, Canada. Welcome to Atlanta, and thanks for taking the time to meet with me.
Thank you, Don.
So, what's happening here at HIMSS for you? How's the show been?
The show's been great. I mean, we've got some very high interest on our Clarity Health Journal. We've produced what we call a consumer health application that engages the family and the patient in the process of care. So with that, we extend the EMR out of the hospitals and out of the clinics and out of the doctor's offices where it has the greatest value to the patient and the family. Our approach has been to really take that model to the end user, to the healthcare consumer.
What's the, based on your experience in Canada, how do you think that can help you in the U.S. market?
Well, the U.S. market right now is booming in terms of healthcare, with the meaningful use provisions, really engaging the families, engaging the patients. And in our case, one of the target markets is women and children, because we found in our market research that really the consumers of this product will be women from the ages of 28 to 48. They're the mothers, they're the wives, they're taking care of their children, they're taking care of possibly their parents as well in the healthcare system, and they're the ones that are going to be searching the net for health information on a regular basis, and also trying to keep their family healthy.
Okay, so this is more of a consumer type of a solution that they're looking to get some information about the...
And tying it into what the hospital has to offer. So in the case of children's hospitals, one of the big factors that they find is that parents are looking for information about their children's care. So when there's a lab result that's being done, when there's tests that are being done on their children in the hospital, they want to be notified about it. And if they're not notified about it, they're calling the pediatrician, they're calling the administrators, and they're spending a lot of time tracking down information, where what the hospitals are seeing is that it's easy for them to provide that information through a portal, through an application like ours, and it saves them internal resources, and it creates better patient satisfaction and increases the experience of dealing with the hospital.
Excellent. So what are you doing to differentiate your solution from other solutions in the market?
Well, the biggest differentiator is the focus on the family. So that's one of the biggest things, because most of the personal health applications that are out there are individual. They're for the person, for one person and one person only. We have taken sort of the Web 2.0 model, where we have sharing of information. So the wife is keeping information about her children, but also sharing that information with other care providers that may not be in a hospital situation, maybe third-party naturopath remedies that are not medically related.
Interesting.
And one of the other things that we've done is we've really embraced the consumer, or in many cases they talk about the pro-consumer, the person who is a professional consumer who will use things like devices like the iPhone, BlackBerry, Android, now in coming up the iPad as well, and really extending the model from not just being a web-based application, but being something you take with you. So if you're out, when you're out and about, you may want to be able to just take the certain information with you, medication. When you're traveling, you're not necessarily going to be tethered to a laptop. You're not going to be going into an internet cafe to check your medical information, but you will be taking around a smartphone. You will be taking around an iPhone, even in the case of readers. So, for example, one of the things that we've done is we export data from our application into a PDF format, and we've demonstrated taking that PDF format, converting it into an iBook into an ebook and actually taking it with you on your Kindle. So we see that whole adoption of my personal information, my medical content that I want to take with me, I can take with me and I can use it anywhere in the world.
Fantastic. Thanks for your time, Saverio.
Thank you, Don.